Dr. Vijaybhasker, Masters in Orthopedics, Hyderabad. The remedies for the sciatic pain. Sciatic pain is nothing but the cord-like nerve dragging down from the back of the spinal cord to into the buttock and going down into the leg is the sciatic nerve. You see here where this is the back, the nerves coming out of spinal cord will lead to a sciatic nerve in the form of bundle of nerves goes down into the lower limb. This is called sciatic nerve. The sciatica means there is a irritation to the nerve is called sciatica. When there is a prolapse of the disc, leads to pressure on the nerve root, leads to irritation of the sciatic nerve. And there is osteophytes of the bones also causes the irritation of the nerve roots is called sciatica. When there is a possibility of tumorous conditions or infection which leads to pressure on the nerve roots leads to sciatica. So these are the multiple causes where the sciatic nerve irritation leads to pain in the lower limb. Though this is the thickest nerve, largest and thickest nerve in the body, this nerve has a bundle of nerve roots which form together, goes into a lower limb from the buttock and supplies the various muscles and cutaneous nerves. When this nerve is being irritated, first of all its kind, it pains at the back and then at gluteal region and down to the posterior aspect of your thigh, medial aspect of your thigh, anterior aspect of your thigh, and furthermore down into the leg and foot. So it has various nerves which form into sciatic nerves, and then that nerve fibers supplies to each muscle of your nerve as well as the cutaneous sensory nerves. So when this nerve is irritated, initially it starts complaining like pain in the back or gluteus region. Then gradually the pain drags down into the leg according to the number of nerve roots are involved in the pressure. So when there is a compression of the mechanical cause leads to number of nerves of the sciatic nerve leads to that variable nerve supplied muscles will be affected. Apart from that, there is a sensory weakness. So the sciatic nerve to be diagnosed by a MRI scan, where the MRI scan will give you a clear picture of a sciatic nerve, where it is passing, where it has been pathological changes, and where there is a compression, what to be done. Once you have done a sciatic nerve traced by MRI, then accordingly, according to the clinical condition of the patient, it should be either treated conservatively or surgically. When there is a typical pain for more than 6 months at all the treatments and then there is no relief from the pain, that means even there is a progressive neurological weakness, that itself signifies to go for a surgery to relieve the compression on the sciatic nerve. So this is the way how we should treat the sciatic nerve. But before that, in the form of conservative treatment, bed rest, nerve healing medicines, nerve relieving medicines, disease modifying medicines, LS belt, physiotherapy, and sometimes we have to give a local injections like steroids to relieve the pressure. Following that, if necessary, surgery if the dragging pain is continuous.